great.
Okay.
Okay, so good evening, everyone. Thank you all so much for joining us this evening for the East Greensboro COVID-19 Impact Forum. My name is Kimberly Sowell. I'm an Assistant City Manager with the City of Greensboro, and I will be your moderator for this evening. As a reminder, all of our participants will remain muted until we open up for the question and answer session. And so our format for this evening will be, we have speakers who will be presenting for us this evening. And so we will go in order for our speakers, and after all presentations have been made, then we will open up the forum for question and answers for other participants. For those who do have questions, we ask that you would put your questions in the chat room, and we will go to those questions in the order in which they are received. So please, as we go through the forum, remember to put questions in the chat area. Then we will address all questions during the question and answer session. I would like to provide an introduction to East Greensboro Now, for those who may not be familiar with the organization. East Greensboro Now is a community development corporation servicing the East Greensboro residents, business owners, and the community for over 23 years. The vision is to make East Greensboro a vibrant residential and commercial community that enhances economic opportunities and improves quality of life. The primary areas of operation and focus are economic development, community development, affordable housing, and minority entrepreneurship. The president is Max Sims, and he has over 20 years of experience in community development and multifamily housing. Phil Barnhill is the executive vice president with over 10 years of experience in consumer and commercial lending, from residential construction, credit analysis training, mortgage lending, and CRA Community Reinvestment Act outreach and entrepreneurship training responsibilities. This evening, as I mentioned, we'll have several speakers lined up to present to us, and I want to give a quick introduction to those who have joined us tonight. And we thank all of you for lending your time and expertise to be on the forum this evening. We have Josie Williams, who is the Executive Director of the Greensboro Housing Coalition, Stephen Seals, the Director for Center for Housing and Community Studies. We have Chris Rivera, the Executive Director with the Guilford County Workforce Development Board. We have Chris Wilson, an Assistant City Manager with the City of Greensboro. Dr. Beth Mulberry, Doctor and Director of the Mustard Seed Community Health. Michelle Lewis, Chief Executive Officer with Triad Adult and Pediatric Medicine. We have Dr. Vanessa Abernathy, Clinical Psychologist and owner of Phoenix Rising and Psychological Services. And I would also like to recognize some of our elected leaders have taken time to join us this evening as well. And I hope they've all been able to get in, but I know our Mayor, Nancy Vaughn, is scheduled to be on with us this evening. Also, Council Member Sharon Hightower and Council Member Dr. Goldie Wells. So we want to make sure that we welcome them as well. So with that said, we'd like to go ahead and get started with our presentation. First, we will hear about evictions and renting during the COVID-19 pandemic. And so with that, I'd like to turn it over to Josie Williams, and also Stephen Seals will be speaking with us on that topic. So please, at this time, Josie Williams and Stephen Seals.
Thank you so much. Josie and I have been working together for 3 or 4 years now on a variety of projects. One of those, the Eviction Resolution Project, got kicked off as a pilot earlier this year and took quite a turn with the impact of COVID displacing more than 30,000 employed folk in Greensboro and causing what potentially is a tidal wave of evictions coming at us. If we can go to the next slide. I want to talk just a moment about the background before COVID. We saw in Greensboro a steady rise of the cost of living. Housing, while affordable compared to many parts of the country, was unaffordable to many of the members of our community. The cost of housing has risen more than 55% in the last decade, while real wages have only raised about 5% during that same time, putting a squeeze on many families and causing a situation of precarity already before the COVID crisis. Next slide. We talk about the cost burden of the renters in Greensboro due to this high cost of housing compared to the low wages that folks have here. Nearly 27,000 households were in a precarious position before COVID hit. They were spending more than 30% of their income on housing and housing-related expenses, leaving very little left for food, for transportation, for childcare, for education, for healthcare, and other expenses. A single month without pay means that many people will be evicted. Next slide. This situation landed us as number 7 in the country for our eviction rate per renter households, and number 1 in the state of North Carolina. Nearly 5,000 writs of possession or lockouts occur every year, while 16,000 households face the potential of eviction with summary ejectment filings. So our rate is very high, about 14 families per day being evicted, again, prior to COVID. Josie, did you want to add anything on that as we were?
Only as far as context and scope, where individuals are coming in voicing the need that they had before COVID hit and how that is being magnified right now. So it's just a dire situation that we're seeing every day.
Next slide, please. This is further data that comes to us from the Sheriff's Department that shows that that rate of eviction peaked in 2013, came down steadily through 2014 to 2018, but hovered around 5,000 lockouts per year. Next slide. We know that housing precarity is not equitably distributed, that there are communities that are disparately impacted. And we can see from this hotspot map that the rate of eviction in South and Southeast Greensboro is much higher than would be expected if all things were equal. Next slide. This is related to market conditions in the neighborhoods in East Greensboro. And next slide. And it has a historical root. This is a homeowners loan corporation map from 1937, otherwise known as a redlining map. And we can see that lending in 1937 was barred or restricted in the same neighborhoods where we see high eviction rates today. So there's a 100-year history here that is centered on policies and processes of the past that are still playing out in East Greensboro. Next slide, please. We then have COVID. And as Josie said, it underscored the difficulty that many families were having prior to the pandemic. Many families were one paycheck away from an eviction and many actually were in the process of an eviction as we came into this crisis that displaced so many people. Next slide, please. You can see in 1 month, we jumped from about 4% unemployment to over 15%. These are early figures still. We do not have the final tallies for April and May. But this jump, as I said, displaces 30,000 working people from the market. And that's folks who lost their jobs. We're not even including the folks who are now underemployed, only earning a few hours a week where they used to be fully employed. Next slide. So there is a wave of evictions coming. As of 4 days ago, the governor's order, the moratorium, Justice Beasley's moratorium, has expired. We're coming up on July 1st, and many families, as many as 30% of families, have already missed 1 month or more of their rents, and they're coming up on what could be their 3rd or 4th month of missing rent. Already there's a backlog, even though the courts had been closed, there's a backlog of over 9,000 cases throughout the state for summary ejectment filings. New filings are happening every day. So we're in a very precarious position with very few resources to address this tidal wave. Next slide. Josie, I'm going to let you take the first stab at this. I think this really showcases the work of the Greensboro Housing Coalition.
This is a very in-depth illustration. And so I just want to give you the highlights and the short version of it. And so basically this program is the partnership we have with North Carolina Legal Aid and UNCG helping us do the evaluation piece of it. The end goal is 2 parts, of course, to preserve housing, give some relief to the tenant, but then also be able to illustrate the benefit of having not only this partnership, but funding attached to a program like this so we can actually mitigate the housing loss. And so you'll see at that top point in red where there's entry points where someone can actually call into legal aid or someone can actually call into the Housing Coalition. And then of course we can always take referrals from other agencies. And once they come in, there's an initial screen where we will do an intake process. And then from that point, it kind of goes through different decision points. The end goal is to decide on us being able to basically do something immediate as far as GHC has the capability to access funds from the funding that we receive from United Way. We have money coming as well soon from the city of Greensboro through the CARES Act fund. And so we can make the immediate decision depending on the case to provide that assistance. Or it may be something that in what we're describing now, this eviction resolution program, where we need to go a step further to provide legal assistance. And that's where North Carolina Legal Aid comes into play. And so when it gets to legal aid is providing us support to provide legal assistance. They will be there in court. They will be advocating for those tenants. And just to give you a brief snapshot of some things that we've seen, it is very important that we have flexibility in funds so that we can be able to provide as much relief as possible. But then also, since we have in this call, I do want to highlight the need and the critical importance for us to have flexibility in the clerk of court, not in a favoritism type way, but we want to help preserve housing. And sometimes that means we may have to be in a position to pay a rent bond. The difficulty that we're facing is clerk of court only takes cash, is what I was told. And so we need to have some leverage as a nonprofit and doing this work to be able to work with them to say, if I can pay this $850 rent bond, allow us to do it and allow us to partner with you to preserve people's housing. Otherwise, we're going to have a lot more folks homeless than what we already have in Greensboro. And so that's just highlighting snapshots of the services that we're offering in this particular program and the critical need for it and for us to have the flexibility and other partnerships like this.
I'd like to add that Order 142 from the governor's office also provides for 6 months in which to pay back utility and rent. So it's vital that in this program, that the way it's designed, it both has the emergency rental assistance, but also the legal support to negotiate payback terms, perhaps lower payback, and support through mediation those tenants who need to take more time to pay back their rent. A very important element there.
And I will point out, I had an opportunity to be on a call earlier today. There was an attorney that's operating in Orange County that was advising us of the situation that they're having there, which is very similar to what we're seeing here in Guilford. And she did point out with the, although, you know, those extensions, those moratoriums, they're expired now. They did create relief, but just as an awareness for individuals and advocates and people on this call, the thing that she had an issue with is that from the date of the order to the end of the order, anything prior to those dates that's outlined in an order does not coincide with a COVID-related incident.
Correct.
So, and Dr. Suze, you want to talk about that a little bit too?
No, go ahead.
So the 21, so it was 21-day order. And so basically just in that time frame prior to that, doesn't help with the tenant that's already in a situation either behind, delinquent prior to this. And so, you know, I told someone earlier, it's like we're working through loopholes. So the relief was there, but there's still so many loopholes when tenants are coming in that, you know, they were already 3-4 months behind. And landlords are feeling this as well. We've had property owners that own multi-unit complexes call us actually in fear and panic because there's 200 people that are at risk in their complexes with that they can actually go to write writs for them to be evicted. And landlords are trying to work with tenants for the most part, but then there are some where we have had cases that we had to pass along, as you can see in this, where legal aid had to advocate and work with the client because under those stays, we did have landlords try to legally evict tenants as well. And so we're looking at multiple layers of issues where there's already a backlog. There are people who were suffering because I always say we were already in a pandemic before COVID hit. This just amplified and it's exacerbating the issues that we already had in housing. And then we have the issue with the moratoriums. It was a 21-day relief. So prior to that, tenants don't have the ability to be qualified as a COVID-related incident, which is, in my opinion, ludicrous. And then you have what is coming forward where these evictions are coming through the pipeline. And so we're seeing that the calls that is coming into the GHC, they are increasing anywhere from 15 to 20% per day. I think I looked at some data last week. We had 400 calls between Monday and Thursday of last week. This week, as of right now, we've seen 500 calls. And so it just, and everyone is beginning to look for rental assistance. Everyone is beginning to look for housing. And so in the midst of people at the risk of losing housing, the housing and the most low affordable need doesn't really exist. Of course, we know that in a large scale. So not to paint a gloom picture, but just to give you the reality of what's happening.
Thank you. Jasmine?
Yes.
And I just wanted, Jasmine, I wasn't sure. Did you want to do questions for later or do we do?
Yes, we were going to do questions at the end, Q&A. So if they have questions, if you all have questions, and Kim will reiterate that, but if they have questions for any of them, just put them in the chat and we'll be sure to go through those questions and address them in the Q&A portion.
Okay.
And I do see that we already have one question, and I see another one just popped in, so I am cataloging those questions, and so we'll come back. So thank you so much, Josie and Stephen. Really appreciate that information. And so next we'll go to Chris Rivera, who will talk to us about employment. So Chris.
Hey, good evening, everyone. Let me start. Can you hear me okay? I don't want to get too far down the road. Kim, is my volume okay?
Yes.
Yeah.
Okay,
We can hear you.
thank you. Thank you again for allowing us to join you. We can go to the first slide if you don't mind, Jasmine. I don't think that anyone would argue that in addition to a community health crisis, this COVID-19 pandemic has waged war on the livelihoods of countless people in our community, particularly attacking the livelihood of their employment. And as such, our system, which is responsible for providing employment and training services throughout Guilford County, has really heightened our focus on working with individuals that have been impacted by COVID-19, whether they have been unemployed, furloughed, and certainly if they have had reduced hours. So can you go to the next slide for me? So when we look at just a very macro or high level impacts of community, we've had nearly 40,000 residents who filed for unemployment since the start of this pandemic, and that reaches back to about March 15th or so. Those individuals may have been qualified or eligible to receive state unemployment benefits, which allow for 12 weeks of payments to $350. There
Chris,
was a piece of legislation. Yes?
Yeah, you're breaking up on us. So just wanted you to know that. I don't know if there's anything you can do, but just wanted you to know that we're having a little problem here.
Sorry about that. Let me switch here. All right, is that any better? My apologies.
Let's go with it and see how it goes.
Okay,
It may
thank
be
you.
better.
There was a piece of
I was going to say, if you also have the ability to dial in, but if it doesn't get better, I'll jump back on and ask you to dial in.
Okay. If I could have 30 seconds to dial in, that probably would be more advantageous. My apologies.
Okay, that's fine. Let's go ahead and give Chris a chance to dial in, because this is really important information, and I want to make sure that we're able to hear what he is explaining to us. So thank you so much for your patience. If you'll give us just a moment. While he's doing that, I will take a moment to announce an initiative that the city of Greensboro has launched. And so I'll put this information in the chat too, but the city has launched a RACE GSO initiative, and RACE is an acronym for Reflecting on and Considering Experiences. And what we're asking members of our community to do is to go to our website, and you'll see over on the left, it's normally on the left on my computer, but there where we highlight important information, you'll see the RACE GSO cycle through. And if you click on that, it'll take you to a website where you can record yourself providing answers to 4 questions we've asked. And the questions range from, did the death of George Floyd impact you? If so, and how? And it gives you the option to, the opportunity to record yourself. You just need access to a camera, whether it's on your phone or your computer. And it also asks you, what can city leaders do to improve the situation in Greensboro? What makes Greensboro an ideal city? So I would invite you and encourage you to go to our website to provide a response to those. And we're cataloging and memorializing your responses. And so city leaders will be taking a look at the responses that we get and responding to and acting on.
Jasmine and Tim.
You're in, Chris.
So Jasmine, you may have to unmute his phone, the phone that just dialed in. Chris, can you unmute yourself and just give her the last 4 digits of your phone?
Okay.
Can you hear me there?
Can you hear me there?
Okay, you're coming through now. Can you give us the last 4 digits of your phone number?
9107.
Okay.
Chris was unmuted.
Okay, so Chris, you'll now have to mute your computer.
My computer.
Your
Can you
mic.
hear me okay?
Yes.
Yep, that's a lot better, a lot better.
Perfect. My apologies.
No problem.
All right. I guess it will be beneficial if my screen freezes so people don't have to see me move around. So, I attempt to pick up where I left off, and I'll move through my comments pretty succinctly. So again, my apologies. I was speaking to just the high-level impact that this pandemic has wreaked on our community. We've had approximately 40,000 residents throughout the county that have had to file for unemployment claims. That has allowed them to receive upwards of 12 weeks of unemployment benefits at $350 per week. There was a federal CARES Act that was passed that does allow for individuals that exhaust that 12 weeks to receive an additional or upwards of 13 weeks of extended benefits. And many have heard or maybe experiencing that there was a supplemental benefit that was afforded in the CARES Act of $600 to stack upon what states were affording their constituents. The problem with that is, and that we are asking for members of our community to remember, is that, in addition to unemployment, coming to an end at some point, the CARES supplement is expected, or I should say will end effective July 31st. And our system, since the onset of this pandemic, has really been encouraging members of the community to take the time to really, at the point in which you feel that you are comfortable to be out and about or back in the workplace and hopefully called back to previous employment, to seek employment as soon as possible. So as that July 31st date looms out there, our system is in a position that we're telling individuals that now is really the time to either secure employment or to invest in yourself or enhance your skills to become more competitive for future opportunities as the economy begins to reopen back up. Next slide, please. So I won't read word for word on this, but as this pandemic has kicked off, we've had to really shift the way that we engage the public and how we provide services through the community or to the community. Our focus has and always will continue to be on connecting individuals to jobs. And we have relationships with countless businesses throughout Guilford County, and the lion's share of them being here in Greensboro that are in fact hiring individuals. We have staff that are available to meet with individuals at this point virtually, meaning video and or telephone, to begin the process of connecting them to those opportunities that we have been working with local businesses on. For those that have been in occupations that have been severely hit by this, and that lies a lot within the hospitality, tourism, retail industry, those jobs at this point are not fully coming back. And there are opportunities in which we can get you connected to training to take those skills that you had in that industry and transition them into other high demand occupations. And as such, we have staff that are working to provide career counseling and online job search assistance to move our residents or individuals towards that. We also have an opportunity for individuals that may not have all of the skills that are necessary to be 100% productive in those roles on day one, opportunities to provide paid internships. And that is a competitive advantage from the perspective that we offset the cost of training for employers, in which they would be more apt or willing to provide that opportunity to individuals that otherwise they would not have normally do so. And then understanding that access, because our doors are still closed, access to us, access to services is minimal at this point. We are pleased to say that as of right now, July 6th, we will be inviting individuals back into our career centers. by appointment only. Individuals are able to text the word jobs to the number that you see on your screen. And for those who don't have or are not seeing the screens, you can text the word jobs to 336-882-4141, and then our staff can begin the process of scheduling those in-person appointments. I would also say that, as Dr. Sillis and Josie were talking about, there are a number of resources that individuals are having to leverage during this pandemic. And whereas we are highly focused on employment and training services, we recognize that there are a lot of things that stand in the way of participating in those services, such as utility needs, rental needs, childcare needs, and things of the like. And so we do partner with a number of organizations throughout Guilford County that in the event that individuals are faced with some sort of hardship that would prohibit them from participating, we can get them connected to those resources rather quickly. Next slide, please. Given that we are, again, not serving individuals, we have had to digitize everything at this point. We have put together a series of different virtual workshops that add value and enable individuals to be, one, prepared for employment, and two, competitive for those opportunities as they come available. And without going through the list of them, things that we are doing virtually now are assisting individuals with preparing resumes. Is that my echo? Okay. Resume preparation, assistance with cover letters, self-care during this pandemic. It's brand new for a lot of people, and having to navigate, having to be home now, supposed to be out productive in the workforce is a bit of a challenge. And so there's some really good workshops and tools that our teams and our partners are providing to participants to learn through those workshops. Understanding this modern professional environment, expungement clinics virtually, financial management, how do you take limited resources made available through unemployment and budget that appropriately so you're not, falling behind. Next slide, please. Last week we launched a partnership with an organization that's called Coursera. And Coursera is an online learning platform or organization that has released access to workforce institutions to provide free online training that have credentials and or certificates for individuals to take advantage of. This offers upwards of about 3,500 different types of courses in multiple languages, with the focus on getting individuals the skills needed, again, to be competitive in the environment that we're in right now. Next slide. Again, there are a number of professional certificates and job paths in which individuals can do. And then what we've done here is we've outlined a couple of different types of courses that they include that are in high demand. So you're looking at IT certifications, medical assistance training, CNC machining, AutoCAD or CAM and manufacturing. But a full list of those, as well as how to take advantage of them at no cost, are on our Guilford Works website, which is guilfordworks.org/Coursera. I'll finish my comments by saying that, our system stands prepared, ready, and all of the above to assist our community in any way that we can. We understand that this extension of phase 2 may cause anxiety, and individuals may not be fully prepared to get back into the workforce. But what we do not want to do, and we would not encourage anyone to do, is to get to the 25th hour or to the 31st or to exhaustion of unemployment benefits and not have a plan. And it doesn't hurt to start the process now to allow us to start moving you or members of the community on a path to success. So again, thank you so much for having us, and I will answer any questions at the end via chat.
Great. Thank you so much, Chris. Really appreciate that information. And so next we'll hear from Chris Wilson, who will give us information on some of the resources and where we can go to find resources during the pandemic. So Chris Wilson.
Thank you, Kim. Want to make sure that you guys can hear me before I go further.
Yes, we can hear you.
Great. Okay. If Jasmine, if I can share my screen, great. If not, I can work through the chat feature. Is that possible?
Yes, I'm gonna send it over to you.
Okay.
Okay, you should be able to share now.
Still no, but not a problem. That's okay. I'm going to put it in the chat feature. So a couple of things that I wanted to share with the group. During the COVID crisis, we have been reaching out to various community groups to message how to best support nonprofits and small businesses. We send out an email exchange daily that gives the latest listing from our business manager in the library department of all grants and support processes that are available at this time. So if and when you have the opportunity to go to our website, and I'm looking at it right now, on our homepage, you'll see that there is a highlighted section that talks about COVID-19 support resources. If you were to go to that listing, you will see, first and foremost, guidance on reopening. So for many of our businesses that are looking at the possibility of reopening right now, it's important to get best recommendations for how to do that safely with an understanding of social guidance, social distancing guidance, excuse me. Then secondly, you're going to see what the latest requests are from both local and state level about how to function within this new normal that we're dealing with. And then beyond that, you're going to be able to see the features of support. And so you can either see that in the links that are listed, or you can look at the buttons just below that. What's included in that is good information on how to support those who may have food disparity challenges right now. There's a great listing through partnerships of the Community Food Task Force, which includes Guilford County Schools and so many of our great food providers, that gives you different locations where you can go to get that product, whether you're a young person or it's a family or whatever your circumstance is. What you'll also see there is our partner agencies, whether it be United Way or the Chamber, and the information that they're offering right now around support services for those folks who are struggling through this pandemic. And then lastly, you'll see the item that I referenced, which is our small business and nonprofit support resource guide. And as you go through that, you'll see that there are numerous grants and funding sources available. So the way we'll keep you updated on that is each day we will publish to the website. You can check it. Some funds run out, and when they do, we will strike through them. We do not remove them because some of those replenish and come back online, and then we'll repopulate. If it is the newest thing available, we'll highlight that in yellow so that if you're a frequent user of our resource, you'll see these things over and over. We want to draw your attention to whatever the newest item is. But many of these grants are targeted. Many of these grants are directed at some of the businesses that we know are struggling right now and are forced to operate in a fashion that is not conducive to best revenue or best income. So if you use our website, you already know this. Certainly, if you have any challenges doing that, reach out to us. We'll be happy to walk you through it. But we wanted to make sure that you knew that this resource was available. I would also say that if you see something there that is of interest to you and you don't feel like you get enough information, of course, the City of Greensboro is happy to support you. East Greensboro NOW, our great partners there, certainly could connect you with any specific representative of an item. And then just lastly, I'll say that there's a few other items hosted in this website that may be of interest to you, which is volunteerism, efforts around volunteerism right now to support agencies that need assistance, donation process for supporting things like our local industry around restaurants and retail. And then lastly, you'll see that there is some information there where you can ask some questions or submit to us, what you don't see. And we certainly want to hear that as well. So if you don't see something, let us know and we'll get that to you. And I'll go ahead,
Great.
Jasmine, as I'm wrapping up, I'll put that link in the chat feature.
Great. Thank you so much, Chris. We're really grateful for the organizations in our cities who have been doing a lot to provide assistance to our residents as well as our businesses, and especially our small businesses. So thank you and your team for pulling that information together to make it convenient to access. So next, we'll move to Dr. Mulberry, who will provide us some really important information that we need to help maintain our safety throughout this pandemic. So, Dr. Mulberry.
Hi, thanks for asking Mustard Seed to be a part of this today. Before I get started, I just wanted to say too, with folks losing their jobs, a lot of them have lost their medical insurance, and we're starting to see a lot of new people that are needing medications refilled for chronic illnesses and those sorts of things. Mustard Seed Community Health, just for folks' information, and I know that Michelle Lewis with Triad Adult and Pediatric Medicine can talk with you about their availability as well, but we are taking new patients. We take anyone from Guilford County who is uninsured and living at 200% or less of the federal poverty level. Most of our patients are uninsured. And then we take all comers, insured or not, from East Greensboro, which is our neighborhood. Okay. And we're right on South English Street, just south of what used to be Lorillard Tobacco ITG. So just so everyone's aware of that, and if they run into folks that are in need. So I wanted to talk a little bit about how to prevent the spread. And I think a lot of folks on this today are very aware of these things. We just need to keep working on everybody in the community. And I have to say, I'm very glad that we are now moving toward requiring masks when we're out in public. And I think the governor's requirement that businesses are now at risk of getting into trouble if they don't, if they have people wandering around in their businesses without wearing masks and not implementing it in their businesses. I think that was a really smart move. So anyway, to prevent the spread, you have to understand how it spreads. And the main way that COVID-19 spreads that we have found is through the small droplets from our respiratory tract, our nose, our mouth, when we cough, sneeze. We have found singing. A number of church choirs have had epidemics within their churches because of getting together to practice with singing. And those droplets can stay in the air for periods of time and be taken in then to the person next to them. There is a theory that some of these respiratory droplets are more aerosolized and in smaller particles. But for what and can stay in the air longer and then possibly infect for longer periods of time and travel longer distances. But for the most part, we're finding that staying 6 feet apart is a pretty safe way to distance yourself. And then obviously wearing masks. And we are also finding that people that are asymptomatic can also spread the virus as well. And there was one thing I wanted to point out with regards to folks that may be asymptomatic at the time they're spreading it. Some of the information that I have read has said that people are most infectious 2 days prior to, they start being most infectious 2 days prior to their symptom onset. and then the peak of their infectiousness is a little bit less than 24 hours before their symptoms start. So it makes it really difficult, you know, to know whether somebody's infectious or not, and that's another good reason to wear a mask when you're out and about. And then their infectiousness declines after about 7 days, and I'll come back to that in a little bit about when I talk about you know, when you can go back to work or and be with other people again if you are infected. I wanted to talk a little bit about masks. And I don't know if anybody, how many people can see, but this is an N95 mask with a valve. This is really important for hospital and medical people to have. So, you know, I understand that there are some folks that are at higher risk that may want something more like this, but for the most part, we're still having difficulties with supplies with medical supplies. So to really utilize, for the most of us, the cloth masks. And the reason why I say cloth masks is they can be washed over and over again and still be good. If they're falling apart, obviously you want to replace them. This is a surgical mask, medical or surgical ear loop mask. And these are good too, but you don't have so many wears with them and you really can't wash them. I've heard of folks, you know, placing them over boiling water for about 10 minutes, and that's considered okay, but they fall apart pretty easily. If you are wearing, to share with folks, if they are wearing these and they get moist, then they don't do so well with keeping particles away from, or blocking particles coming out and coming in. So these are okay to wear, but in the general populace, but again, I know our clinic is having difficulty finding them and the cost is going up because everybody's using them. And we see a lot of them on the road and in parking lots. So that's not the way to dispose of them either, and to talk with people about that when you're out and about. We do have people in our community that are making masks. Some are giving them away free. I know here in Cottage Grove in East Greensboro, we have a woman that's making masks for both children and adults of different sizes. And, you know, just ask people who are in your medical profession. We have a couple of community health workers that are actually giving those out. Those are places where you can get them. And a lot of times you can see stuff on social media where you can get these as well. And if you can't get a nicely made mask, taking, you know, a scarf and folding it in 3 and then putting the rubber bands on here, and then you flip it and you put, you know, one end into the other, and then you put your face, and I know I'm not doing this very well, and we actually have this on Facebook with Mustard Seed. You can go there and look, but they have this on how to do this online, and then the rubber bands go over your ears, okay? And again, you can take this home and wash it. So those things are important. And I keep masks in my car, and when I go into a grocery store, this thing's on me before I even hit the door. As I'm getting out of my car, I put it in. The other part where we're finding that people can pick up the virus is on just surfaces, especially if they're frequently touched. And so for this reason, I would encourage everybody, if you can find them, to have like Lysol wipes or something similar in their car, or the hand sanitizer, and it should be 60% alcohol or more, and have that in your car. And you know, and that's just temporary. And then when you get home or wherever you're going, you know, make sure you're washing your hands for 20 seconds and getting in between your fingers. And this is something I'm not sure all of us think about, but think about all the things you're touching, like let's say the grocery store, you know, and you use your credit card to make your payment, and they all have those windows and that are in between you and the person. And then you're putting in your credit card, and they've got this plastic flap now over the buttons. It doesn't keep you any safer to touch that plastic because a bunch of other people have touched it. So recognize that if you're if you're punching those buttons, or if you're at a gas station or wherever you're using buttons that are frequently used by other people, don't touch your face after you've touched those things. Get out to your car, or if you have it with you, you know, clean your hands. I even wipe off my credit card when I'm done, especially if somebody else has touched it. I'm going to wipe that off before I put it back in my wallet. Those are little things to think about, and you know, it's hard to remember all of that stuff. And we all are constantly touching our face, and it's really good to try and work on making a habit of not doing that. And that also goes for the masks. Stop touching the mask, because that's where the particles are coming at you. You've blocked your face, now you're touching your mask, you take the mask off, then you touch your face. So those are all things to keep reminding people about. One other thing about the masks too, if there's no metal piece to put around your nose so it stays in place, then you probably have it upside down. So if you see people messing with their mask and it's going up over their eyes and that sort of thing, talk with them about putting that metal piece around the nose so it stays in place. If they have problems with their glasses, have them move it down farther over the mask. These are reading glasses, so I can bring it down and it doesn't affect my vision, but then it keeps it from fogging up, okay? And all these things are important, because if we keep messing with things with our hands and then touch our face, we increase our risk even if we're wearing a mask. And here's the thing about gloves. If you're not going to use them for a specific thing and then throw them away right then, they're not helpful. They're the same as hands, because if you're wearing gloves and you're touching a bunch of different things and they come back to your face or somebody else's stuff, you're spreading stuff. So I actually don't recommend anybody wearing gloves except if you're using them for a one-time sort of short-term use and then they get thrown away and then you go wash your hands again. I think initially I've seen a lot of people wearing gloves and they had a false sense of security with them, and they were touching a lot of things, and basically it was the same as having bare hands and not washing your hands. So with that said, I also want to talk about the hand sanitizers that are out there. And I wish I had a slide for this. I'm sorry I didn't get this made. There are some hand sanitizer warnings out there, and you can go to the FDA's website to see this. But there are 9 different hand sanitizers out there now, and they can have methanol in them, which is the same as wood alcohol, and that's toxic. And you can get toxic even through the skin. So I would really encourage you to go and get that list, and I can send the list to someone. Jasmine, I don't know if you could use that and put that out there for folks as well. Cone has it, I believe, on their website as well. And I would also encourage everyone to go look at Cone's website to get updates on a number of things, as well as the CDC website. They go through a lot of this information very clearly for both medical providers and also just the general public. I think those are 2 great resources. Okay, let's see if there is a, I think that covers that. Folks that we need to be more worried about that are at higher risk for severe illness. Wanted to go over those a little bit. People that are 65 years and older, if they're living in some sort of long-term facility like nursing homes, if they have chronic lung disease or moderate to severe asthma, heart conditions, severe heart conditions, and if they're immunocompromised. So if somebody has like cancer, or if they're on a medication that that is like requires corticosteroids or immunosuppressants, things that suppress their immune system, those folks are the ones that are at higher risk. They have found with time, I think most folks are aware of this, people with severe obesity, diabetes, chronic kidney disease on dialysis, and liver disease. All of those folks are at increased risk of having a bad outcome if they get infected. And so a couple of things for those folks I can see wearing masks more like this because of the concern for them having a bad outcome. Another thing I'd like to bring up with this too is if you have a patient or if you have a family member or you know somebody that needs some medical attention and they are at higher risk, a lot of us now have telehealth or virtual visits. And we've been doing virtual visits for a while. We're a member of the North Carolina Association of Free and Charitable Clinics, and they've provided us with UpDocs. And we can do a virtual visit, you know, on our laptops where we actually see the patient, or we can do it by telephone. And, you know, if it's simply they just need to talk to us about something and we can get a pretty good idea looking at them over the phone, a rash, or they just need a medication refill, they just need to call in and we can take care of that. And I think a lot of clinics are handling things that way. So they don't have to come in and have an increased risk of exposure. Some other things too is if you have a loved one or someone with higher risk, have them do a 90-day refill instead of a month at a time. So they're not either somebody that's living in their house or they are not having to go to the pharmacy so frequently and again exposing themselves, have a higher risk of exposing themselves. I just wanted to also say, even just being 65 or older, 8 out of 10 people who die from COVID-19 in the US are 65 plus. And it goes up really rapidly with age. You know, if you're 65 to 84, 4 to 11% of the folks in that age group that get COVID-19 die. And then if you're 85 plus, it can go up to 27% of those folks that get infected. It's the range is 10 to 27%. So the age in particular really seems to make a difference. So what do you do if you're sick? That's a frequent question that we're getting. You know, if you have fever, cough, sore throat, body aches, some folks are having some GI symptoms with diarrhea, abdominal discomfort. You know, keep track of your symptoms, take your temperature. It's really good to be able to track this, but unfortunately we still are having a low level of being able to test. So if you're not at high risk and you're having those symptoms, we're still telling folks stay at home. If you can get checked, I think that's great. We'll be talking a little bit about that in a second. Tried Adult and Pediatric Medicine actually has a lot of ability to test right now. But otherwise, stay home and consider yourself that you've got COVID-19 and isolate yourself. And if you have other people in the house that are not ill, then you really want to separate yourself from them as well. So what we're telling folks is if we think that you've got COVID-19, whether you get tested or not, separate yourself. And when you go into a room that everybody uses, like let's say the kitchen, try and do that when you're there by yourself. Wear your mask when you go in there, and then wipe everything down on your way out. You know, we encourage folks to sleep in different rooms than their spouses if they're sick and their spouse isn't sick, that sort of thing. Again, monitoring your symptoms with fever is important. If you start having trouble breathing, if you're having persistent chest pain or pressure, if you have any sort of confusion, inability to wake up or stay awake, I mean, obviously these are family members following some of these symptoms as well. If someone notices bluish lips, that maybe they're not getting enough oxygen, then you need to call your doctor or get to the emergency room. Those are the symptoms to look for, okay? If you're alone in the room, for those folks that are ill, again, whether they've tested positive or not, you can take your mask off if nobody else is coming into that room, okay? If you're coughing and sneezing, just like you would do, I tell people to do this even if they've got a mask on, cough into your elbow. That's just another barrier. Wash your hands often. If you can't wash your hands, again, you can use the Lysol wipes, or you can use the hand sanitizer. And again, for the whole family, they just need to be cleaning high touch surfaces every day. Light switches, handles on the sinks, tubs, all that sort of thing. Just kind of think of what you're always touching when you come into a room. And then, so talking about the isolation. So there are symptom-based strategies and there are test-based strategies for that. If a person who has had COVID-19 symptoms and they were directed to just do self-care at home, the recommendations now from the CDC are that they need to be at least 3 days without a fever, without taking anything for a fever. So no Tylenol or ibuprofen. Oh, and by the way, the recommendations, a lot of folks were told early on not to take ibuprofen. And there's a whole reason behind that, but that it could make you at increased risk for a bad outcome with the virus. They're not finding that at this point, and so the CDC removed that recommendation to not use ibuprofen for fever or body aches, just so folks are aware of that as well. So 3 days without a fever, without taking anything that brings a fever down, and their symptoms are improving. And at least 10 days have passed since their symptoms first appeared, okay? So at least 10 days from when they first got sick, they have to be improving, and they have to be 3 days without a fever, without taking anything for a fever, okay? If they've been tested, then they still have to have a resolution of a fever, and then improvement of their symptoms, and then they have to have 2 negative results. So being tested again for COVID-19, they have to have 2 negative results 24 hours apart. And these are FDA approved, obviously, lab tests. Okay. And then for folks that have not had symptoms, but tested positive and are under isolation because they tested positive. Am I making that clear, the differences here? Anyway, let me know if not. Again, there's a time-based strategy. If at least 10 days have passed since the date of their first positive COVID-19 diagnostic test, and they haven't developed symptoms, then they can come out of self-isolation. If they develop symptoms, then they start over with somebody that tested positive with symptoms, that 3 days and then getting better, no fever, all that stuff, okay? If they're going to get retested, then again, they have to have 2 negative FDA approved tests 24 hours apart. You know, and you might see that more so in folks that are medical providers, nurses, paramedics, physicians, etc., that they need them to get back to work, and they're not symptomatic. So let's test them a little earlier and see if we can get them back on the job. Okay. One thing that is I initially found somewhat confusing is that there's a difference from somebody who's tested positive and are asymptomatic as compared to somebody that's been exposed to another person that tested positive, whether or not they were asymptomatic. So this is somebody that's been exposed to COVID-19, has not been tested, and what is recommended for them is to quarantine for 14 days. Okay, and so the reason why it's longer than that 10 days is because there's what we call an incubation period where people can be asymptomatic, but the virus is replicating in their body and they haven't yet developed any symptoms. So they give that longer period of time to see if they indeed become sick with it. So there's that as well. And then one thing I wanted to talk about, and I can talk about this later if folks kind of want to know some of the stats here locally, but there are outpatient testing now through Cone. And again, you can find this on Cone's website because right now it's kind of what's coming up in the next 2 weeks. And so beyond that, you're going to have to check the Cone website, and then Triad Adult and Pediatric Medicine, along with Guilford County Health Department, has testing too. And for the regular daily testing at the Green Valley campus, which used to be Women's Hospital for Cone, that is open from 8 a.m. till 4 p.m. a day. And that's just here locally. There's some other Cone sites too. And you really have to meet criteria to get tested there. So 65 years of age and older with symptoms, patients with underlying conditions with symptoms, first responders with symptoms, asymptomatic patients from high-risk environments like living in a group home or where you're it's hard to distance yourself. And then asymptomatic COVID convalescent plasma donors can go there as well and get tested. And then they have their mobile units, and like Mount Zion Baptist Church has been having those every Wednesday, and I think they're doing that till the end of June. And they had one yesterday, and I think they have at least one more, and it may progress. And then there's one tomorrow in High Point at GTCC with Cone's mobile unit. Also, CVS has a drive-through testing. For all of these, you want an ID, a picture ID, and you need to wear a mask, and let's see, and an insurance card if you have insurance. But for most of these, it looks like they're not requiring insurance. I know the Cone one, you don't, Guilford County, you don't. And so the CVS requires ID. You have to show in-state residency proof, and they want your email so they can send your test confirmation. If you are uninsured, they want your social security number. So if they need your social security number for folks that aren't aware, that means our undocumented folks can't be tested.
Right.
So anyway, that's what I have, and we'll take questions later.
Great. Thank you so much. Wealth of information, Dr. Beth. Thank you so much. And so next we'll have Michelle Lewis, and I know Dr. Beth touched on some of the testing. So Michelle, if you could give us some information related to testing as well.
Sure. Can you hear me?
Yes.
All right. So thank you, Dr. Mulberry. That was a wealth of information and very valuable information. And thank you for the service that Mustard Seed provides in our community. And I want to thank also the East Greensboro NOW for this opportunity. I am Michelle Lewis with Triad Adult and Pediatric Medicine. Some people know us as TAPM, T-A-P-M for short, but we are a federally qualified health center with services in Greensboro and High Point. But for the Greensboro locations, which you are probably more interested in, we have locations on Eugene Street, Arlington Street, and a pediatric office on Wendover Avenue in Greensboro. We do provide primary health care to clients regardless of their ability to pay. So they don't have to have insurance, but if they have insurance, we take them as well. So we do provide face-to-face visits, and we are practicing social distancing with all of the things going on with COVID, as well as telehealth. We do provide well visits, sick visits, immunizations. We also have integrated behavioral health services where we have an LCSW at all of our sites to help with our behavioral health concerns from our clients. We do offer some specialty services, and I'm going to touch on just a few of them, which is asthma and allergy. We do have circumcision services, Nexplanon insertion, nutrition, chronic care management, and we've recently incorporated a FIT program, formerly incarcerated transition program, where we have healthcare services for those that have recently been released from jail or from prison. And we also try to connect them with resources in the community as well as provide healthcare for those particular clients. We do provide a wealth of community outreach in the Greensboro and High Point area, but as you know, most of the outreach recently has been around COVID-19. And despite what some think, COVID-19 has not gone away, and it probably will not go away for a little while. So we have continued our focus in that area. But I do want to encourage our community to continue to seek medical care, because some have delayed medical care because of COVID-19. but we are starting to open things back up. And as Dr. Mulberry stated earlier, we have telehealth, and you don't have to come into the office if you need a visit from your medical provider. So I want to talk to you a little bit about our COVID-19 testing. You can move to the next slide. Thank you. We are providing COVID-19 testing at our medical offices for our established patients only. If you are a new patient, we will provide COVID testing for you as well. But for those that are not patients of TAPLM, we have incorporated some community testing. And I do call this our marathon mission, or our mission marathon, because we are in the Greensboro and High Point area to serve the vulnerable population. So the areas that we have gone in over the past 3 weeks have been to the vulnerable populations. We've worked with the Greensboro Housing Authority, and we've been at Hall Towers, Gateway Towers. We're at Claremont this week. We've been at the Evangel Fellowship Church, which is in East Greensboro. And so just, I call that our marathon mission, or mission marathon. And we are trying to serve those that perhaps cannot get to any of our offices to get testing. And we're really trying to go right where the people are that need testing. Over the past 3 weeks, we have tested roughly 1,100 people in the community. And that's just been in 3 weeks with a couple of hours a day. So we're happy to report that. But the upcoming testings that we do have is at Claremont Courts, as I stated. We're there this week, and we'll be there tomorrow from 1 p.m. to 5 p.m. We will be at Bethany Fellowship on July 11th from 10 to 2. We'll be in Smith Homes July 15th through 17th from 1 to 5. We will be at the Seventh-day Adventist Church on East Market Street on July 22nd, and again on July 29th. And then we'll be back at Evangel Fellowship Church in Greensboro sometime in August. And we are open to assisting with other organizations that want to help us with testing in the Northeast area. And so to register, you would just go to our website, which is www.tapmedicine.com, and click on community outreach. And then the testing is free, and results are back within 3 to 5 business days. And we do test with LabCorp. They have been pretty good about getting our results back within a timely manner. Next slide, please, Jasmine. And as Dr. Mulberry stated, there are several other organizations in the area that's testing. Cone, the Guilford County Health Department, and also DHHS has a site that you can go to, and I can send you that link, where it says to find my test site. And if an organization has listed their test site in this area or all over North Carolina, you can find somewhere that's testing for COVID-19. And they also have a prevent and protect toolkit that's out there as well, and I can share that link. But we do have some valuable partners that's working with us for this testing initiative, and that's the Guilford County Department of Public Health, United Healthcare, the Greensboro Housing Authority, High Point Housing Authority, the Guilford County Emergency Management System, and recently Old North State Medical Society has come on board with assisting us with this testing endeavor. So that's all I have for you today, but I do want to remind you, as Dr. Mulberry stated earlier, about wearing masks, and remind you about the 3 W's that Governor Cooper put out there. And that's, the first one is to wear your mask. And Mayor Vaughn has been proactive, and Governor Cooper has been proactive in putting that information out there. The second W is to wait 6 feet apart. And then that third W is to wash your hands often. And Dr. Mulberry talked about washing your hands and the type of hand sanitizer that we need to use. And I just would like to admonish all that's on this Zoom meeting today, because the governor has been proactive and the mayor has been proactive, that we have to take individual responsibility for ourselves and be proactive as well, and remember the 3 W's. And I am open for questions, and you can put them in the chat, and I will be glad to respond to you. So thank you for your time today.
Awesome information. Thank you so much, Michelle. And our last speaker will be Dr. Vanessa Abernathy with really critical information on a topic that we seem to have forgotten about during COVID-19, but it is really important for our families' mental wellness to be in good shape. So, Dr. Abernathy.
Good evening, everyone. Thank you first and foremost to Greensboro Now for throwing my name in the hat. I'm so grateful to be a part of this community. I was educated. I've actually been, my heart and my head has been in North Carolina since I was 18. I moved here from Ohio to attend North Carolina Central University and then went on to do Divinity School in Durham. So even though I'm from Ohio, North Carolina is my home. And my final education was in California, but I always knew that I was going to come back with the knowledge and the training that I received to come back to this community. So thank you so much. I don't take it lightly that I'm able to be here. I want to say that this program has been so comprehensive. You've already touched on so many of the issues that impact our mental health and well-being in this time. The fact that we started out with basic necessities of food disparities and food insecurities and housing and employment, those are the basic needs whenever we're talking about health and wellness. If we can address that, you could really, once those needs are met, people can receive the information that's needed to survive. And so I really appreciate that. But what I'll do is I want to really try to empower us on a family level. So we're talking about the different systems in which we have been impacted by this virus, but we forget that there's still so much power and influence for health and wellness within our own families. If nothing else, we've been called back home. So I want to first just talk a little bit about the impact. So all of us experience stress. There's what we call good stress and eustress, and then there's distress, where there's too much. Stress is just a demand on any system. So if you win the lottery, that's a stress. If you get married, that's a stress. If you get divorced, it may be a stress as well. But when that system is taxed beyond the resources we have, it becomes distress. And then when you add something like the pandemics that we're experiencing, you have something that is actually traumatic that has real or perceived chances of death, and we have all the reports. So I'm going to talk a little bit about that as well. So then you have trauma. And with that, people start to feel different things. I think we forget that, we do have emotions and feelings, and our mood is impacted, and it's all connected. So when you look at some of the stress, how to know if you're experiencing stress or distress from the virus, you might see some of these, and these are just pretty common. Excessive fear and worry. And one of the things that's challenging with this type of fear, fear is one thing to deal with when it's not realistic. But when you have a realistic fear, it is constant. And even when we're sleeping, our bodies, our minds are trying to problem solve. And so you might see excessive worry, changes in sleep, and this is all across the lifespan. Changes in sleep. You may be sleeping more, excessive sleep, hypersomnia. You may not get enough sleep, insomnia. You might not have restful sleep. And I always tell people, sleep is like a raincoat. If it were to rain right now, and it's kind of looking a little dark out here, me putting on a raincoat is not going to stop the rain, but what it will do is lessen the impact on me. So everything is more stressful when we don't get enough sleep. And with the pandemic and our days and nights kind of rolling into each other, whether we're working at home or in between jobs, we lose track of time, especially when we're up worrying. So as much as we can, if we can hold that time in mind, keep our biological clocks, when the sun comes up, open our eyes, actually, if it's possible to safely get outside and get some of that vitamin D, it helps to keep us regulated also in our mood and in our relationships as well. Trouble concentrating, increased problems with chronic health. So a lot of people, they may have mental health issues, but they're not going to present with that. They're going to present with some of the somatic complaints because emotion has motion. It moves all around our body. Sometimes we feel like our mind is racing. Sometimes it's hard to think of things that we know or put in things that we want to know. We feel it in our tightness in our chest, our shoulders, nausea, vomiting, diarrhea, things like that. So a lot of times you may start out complaining about what's happening in your body, but it may be a real manifestation of what's happening mentally as well. Also, you may have increased difficulties with mental health issues if there were pre-existing conditions for anxiety. I always say depression is the common cold of the mind, and anxiety is its annoying cousin. And so a lot of times we're doing things to manage that on our own because we go to the doctor, or we're not sure that we can access those resources, or we don't have insurance. But there's so many resources that have already been named. There's plenty to do without self-medicating. So a lot of people are coping in ways that really can't be dosed and can really make them feel worse before they feel better. So you might see an increase in alcohol use, but the concern is alcohol is a depressant. Even on our best day, it's just what it does to the body. It makes the brain, kind of low. And then marijuana is also a depressant. So someone may be using these to kind of take the edge off, feel a little less anxious, but over time, they may not get back to that place where their body's natural release of those brain chemicals are actually able to work. And then you also have the flip side with caffeine. Caffeine is a stimulant. So if you're already anxious, you want to look at these lifestyle changes that you can take control of. You don't want to buy as much soda. You don't want to buy, as much coffee. If you actually get up earlier and walk briskly for 15 minutes, or there's everyone and their mom has some fitness YouTube going on, but we also have some valuable resources that have already been mentioned here as far as fitness. And then also you want to make sure that your sleep hygiene is also, which I've already mentioned. The other thing you may see an increase, changes in your libido. This is a family forum, so I don't know the age groups here, but if you look up the word libido, that may increase or it may decrease. And you want to be able to negotiate those in your relationships as well, but also notice that it may be a matter of mental health. And then what are some things you can do? You can have better self-care. One of the things that's important, especially for the people in our community right now, is that we also have this other, some have called it, domestic terrorism, racial uprising, whatever you want to call it. It does add another layer of distress and trauma. And not only, it taps into things like guilt and shame. Guilt is feeling bad about what you did, but shame really is something where you feel bad about who you are. So if you see this systemic threat of death across the board and you are trying to manage that, you have to consider ways that just feeling good about who you are and how you're going to address that. One of the things that I highly, highly, highly recommend, where I was going with that is, if you feel that you want to fight and you want to protest and you want to be part of the uprising to make change, you really are going to be the best soldier if you have the best care of your whole self. So if you want to live to fight another day, to vote, to speak out, to go to the community forums and let your voice be heard, you have nutrition, getting the best nutrition you can, accessing some of the resources that are out there. There are people who are actually giving away and donating healthy foods and vegetables and fruits and protein that's going to help sustain you for another day. The other thing is, we're here in the Bible Belt, so it won't be foreign for anybody to hear me say, faith comes by hearing and hearing, right? Well, fear happens the same way. So unless you're a news media person where you have to do this as a part of your job, I would highly recommend that you not listen to the media more than once or twice a day. And if so, pick one or two reputable, as fair as we can get in this nation, news sources. So the CDC, the World Health Organization, and you figure out, and even sometimes with some of this forums that I've been a part of, even in this week, I've learned which personalities are actively engaged in this conversation. So that may be a reputable source, but you want to listen to it, and it's okay to take a break. And it's okay to not let your children watch it all of the time, so that you can mediate the amount of information that's coming in. And because a lot of times it's sensationalized. There are cases of people who, I personally know some people who had tested positive in other states and they recovered, but that doesn't really make the news. So we can navigate that and try to take control as much as we can. Other self-care is to breathe. A lot of times when we're in distress, we stop breathing. I would guide you all through a deep breathing exercise, but if you would just check in with your belly, breathe in through your nose, out through your mouth, you start to feel a little bit of relaxation, and do that over time. Different spiritual disciplines like prayer, scripture reading, meditation. I have clients who are people of various faiths, and where they may not have been praying as frequently, they're able to connect more with people in their mosque or their synagogue or their church to do that in a way that's more meaningful, and really can incorporate larger stories to kind of change the narrative of what they're telling themselves about what's happening. A little exercise, if you can get some brisk walking, that releases those feel-good chemicals into the body and the brain. I've already mentioned sleep hygiene. I'm going to go out on a limb and say that we're all adults. Yeah, I'm not going to go there about sleep. You just want to make sure you train your brain to know what to do in your bedroom. You talking with supportive others, connecting by phone, especially some of our elders who are not on social media, who are not on Zoom, making sure to pick up the phone. A lot of churches are remembering to have phone trees now for information, but also for prayer calls. And so finding ways to connect across the generations as well. Another important feature about this, and a risk, especially in some of our communities, is a heightened risk for, and this is across, it doesn't matter the class or status, but there's an increased risk for domestic violence across all families, but especially when some of those core basic needs aren't being met and people feel overwhelmed. Depression doesn't always look like decreased energy for some, and especially for teens. Depression can be more agitation. It could be irritability, so that becomes more aggression at times. And so if you have hopelessness plus all of this energy built up and this irritability in the people closest to you, because every good relationship needs that balance of togetherness and distance, and you're not able to get distance, then that can just be a very toxic environment for safety and health. So you want to be mindful when you're having other people care for your child, because we're having to be creative with child care. You want to know that the person who is watching your child as much as you can is someone, especially if your child can't talk, you always want to empower your children with language that says you have a right to your own body. You want to relate to them in a way that lets them, that little alarm go off in them. You want to tell them things like, there's no secrets from daddy or no secrets from mommy or grandma. You can surprise me, but there are no secrets. You always want to keep the communication open. You can do a simple thing like, what was your high today? And they tell you. What was your low today? What was your favorite part? A lot of the cartoons do that. What was your favorite part of the day? And so you have that communication that remains open, even for a moment, so that you can observe your child if they're young, and you want to make sure there's no risk. For children who have open communication, usually are more open to sharing and often are at less risk. But also for elder abuse, there are many who don't have respite care. And so whenever we're looking for resources, that's one that I would encourage you to find. If you are caring for someone who is older in the community and you're feeling worn out, even if you don't feel worn out, to have those moments where someone else can support you, can share the responsibility. Maybe there's some things you can delegate, especially since everyone can't come into the home. My grandmother, one of my best friends, she had been in a facility in Ohio for a while, and then as soon as she came back, she still couldn't have visitors. So we all had to be mindful. Some of us sent masks. You know, my mom crochets, so she sent masks, and different people come at different times when she's with her occupational therapist. They do laundry. You know, other family members do laundry. They do folding. They change her bedding. So there are different ways to share the responsibility, but it's okay to have a running list of how others might help you. I want to give you, you want to not take those things lightly as far as child abuse, domestic violence, or, you know, sexual abuse or elder abuse, and it's okay to report. If you call Child Protective Services, their goal initially is not to put you in jail or remove the child, but if things start to escalate, it's best to reach out before something happens than later, because at its best, what the system does is we wrap around that family and we say, this family has been under the radar. They may be able to use more resources, many of which have already been named, and we can start to plug and kind of, you become the hub and we wrap around you to get you those resources. But two agencies that automatically come to mind when I think about these risks in particular, as far as domestic violence and any type of misuse and abuse in a family, one is the Family Justice Center, and it's located downtown on Green Street. It's almost like a one-stop shop. You can go there and speak with someone from legal aid. You can speak to someone from Family Services of the Piedmont, where there may be therapy. There may be someone to sit down with you and actually devise a domestic violence escape plan, thinking it in a systemic way, knowing that now the doctor's offices are opening up. You have interactions with your schools, clergy, and medical professionals, healthcare professionals are mandated reporters. We're not mandated investigators, but we are mandated reporters. So if you let us know, we are trained to think through this with you. In a lot of ways, things just, you know, start to wrap around you again. So the Family Justice Center, and I'm sure our resourceful and responsive people who are working in the chat will share this at some point, but the phone number is 336-641-SAFE, SAFE. And then the other, of course, is Family Services of the Piedmont, which is still also located. They have representatives there as well, and that's 336-273-7273. But you do want to report it. You do want to, even if it's witnessing domestic violence, research has shown can have create post-traumatic stress in children, even as early as under one. In my early work and training, I work with children 3 to 5 who have behavioral problems from trauma and abuse and neglect, and so it can manifest in those ways. So we definitely want to treat ourselves with kid gloves. We don't want to be so hard on ourselves when it comes to all the chores that we need to do. You know, if there's dishes in your sinks right now, don't look at the dishes, just keep looking forward and knowing you're doing the best that you can. I hear someone.
Thank you, Dr. Abernathy. This is Kim. I chimed in and I was chuckling.
Oh, okay.
You said don't look at the dishes.
No, don't look. Do I have more time, or do you want me to just wait for questions?
We're actually at a point where we need to go into our question and answer session. So if you don't mind,
I think I gave the most important pieces as far as the safety risks and how to recognize the stress, and we can talk about some other ways of what to do instead of, you know, worrying about all of this and how to get a break. But thank you.
Thank you so much. I feel better already. I feel like I've been on the sofa. So thank you so much for that information. So now we do want to go to some of the questions that were raised in our chat. And so as I ask the questions, I'll ask our presenters if you can keep your responses real brief to maybe about a minute, and then if there's any other information that we need to get to someone, we can certainly do that. But the first one I'll direct to Josie, And the question is, if tenants don't know where to go, can landlords approach the Housing Coalition on behalf of their tenants? And then also, does the Greensboro Housing Coalition have language services?
Kim, you sound, it's a little broken. Can you repeat that?
I'm broken. Okay, I'm sorry. Is this better?
A little, but you go ahead. Just repeat it for me.
Okay. Okay. The question is, can landlords approach the Greensboro Housing Coalition on behalf of tenants for any assistance they may need? And does the Greensboro Housing Coalition have language services?
The tenant has to do the intake, so the landlord can refer the tenant, but not approach the Housing Coalition on behalf of the tenant as far as receiving and giving information. One, due to confidentiality, but then two, the tenant has to individually go through the intake process to receive assistance. We do have a staff member that speaks Spanish, which is predominantly the clientele that we see as far as the need for non-English speaking services. We are actually developing a partnership with an organization in Greensboro to provide access to the material, all forms, tenant right education, healthy homes education into the different dialects of the Montagnard community. And we are about to bring someone onto our staff that speaks Arabic. And so we are working on developing those materials in different language. Right now, we do have the most, the service that we are able to provide our services in Spanish. Does that answer the question?
Great. Yes, thank you so much.
You're welcome.
And the next question is for Chris Rivera. And so the question is, how do employers or small businesses, businesses such as HVAC, plumbers, electricians, etc., how do they partner with you in order to provide a pipeline for future employees? And then is this part of the Job Path program?
Yeah, thank you for that question, and it's a very complex answer. So I think that the best way to address that would be businesses that are interested in partnering with our workforce system. There is a contact form that I'll drop in the chat that you can complete. We have a team of business services representatives that would reach out to begin that conversation. That's what the needs are, what types of pipelines we need to build, and how we can partner with you. So I'll drop that in the chat. Hopefully that answers the question.
Great. Thank you so much, Chris. And the next question is for Dr. Mulberry. So the question is, does the Mustard Seed partner with other community health organizations like City Block?
We do partner. We're actually in a, not with City Block, but we're open. But we do partner with Greensboro Housing Coalition, New Hope Community Development Group, and the Cottage Grove Neighborhood Association pretty closely. And with that group, it's expanded exponentially under Josie's leadership. So that would be my answer to that.
Sounds good. And I did see where we did also have some other partnerships that Michelle Lewis mentioned in her presentation. So it's great to see that so many of our health providers are partnering together with the situation that we're in. So thank you all so much for all of the work that you're doing for our community. And there may be people on the phone that have a question and were not able to enter a question into chat. And so if there is anyone on the phone that would like to pose a question, you can hit *6 to unmute yourself if you would like to, and I'll just pause for a few seconds to listen to see if anyone has a question.
Kim, this is Councilwoman Hightower. How are you?
Hey there, how are you?
Hi, very well. While you're waiting on questions, I would like to recognize Bernita Sims of Welfare Reform Liaison. She's on the call. Her organization also provides rental mortgage and utility assistance. And I'd like for her to speak briefly to that so people on the call know that there are other resources and what they are to provide some assistance during this time. And of course, even before COVID, they do.
Yeah, absolutely, Ms. Sims, if you could provide that information for us, please.
I think, am I unmuted? Can you hear me?
Yes.
Okay, very good. Our Community Action Agency was one of the recipients of some NC Cares dollars through the Department of Health and Human Services, as were all community action agencies across the country. And so when we put together our program plan for the use of those dollars, we decided to do the emergency services, which most individuals are doing. That's the rental, mortgage, utility, childcare, transportation services. But we also included in that program the need and the willingness to be able to work with some mental and behavioral health issues. We understand that families are going through it, as we just found out on the phone when we talked about you know, the stress families are experiencing as a result of all this. So we have allocated some dollars to help families navigate those waters. So where there are issues where they need to talk to a professional, we put dollars aside to help those families make that happen. We work with individuals that are at 200% or below of the federal poverty level. So that was raised on purpose because we needed to include some other individuals in where we typically only do at 125%. So I would be happy to share more information with you around what we're doing with our emergency services. And then we also did allocate some dollars for training, because we understood that individuals will have to go back to work, some not in the jobs that they traditionally were doing. And so there's a reinvention that will have to take place as they move through this whole COVID-19 situation. So we do have training dollars allocated in those dollars as well. So I'm looking forward to working with individuals on this call and hopefully be able to assist in folks that, you know, traditionally maybe don't know where the services are. But we're here, we're in East Greensboro. Our headquarters are located there. We've been here about 5 years almost. And so we would love to be able to sit down and have a conversation about how we might be able to partner with some of the individuals on this Zoom call. Thank you.
Awesome. Thank you so much, Ms. Sims. And before we wrap up, I did want to provide space for Dr. Wells and Councilwoman Hightower to be able to make some remarks. But before I go to them, I wanted to give Dr. Mulberry another opportunity. She wanted to clarify her response to a question about the partnership with City Block. So Dr. Mulberry?
After Googling City Block, I recognize it. It looks like it's a clinic of, and maybe like they have it in different cities and that sort of thing. We're a standalone nonprofit, integrated primary medical and behavioral health care, mental health care, and are not associated, though we work with the hospital and other organizations. We're a standalone clinic.
Okay. Thank you so much for that clarification. And so I would like to go now to Dr. Wells, Dr. Goldie Wells, just to allow time for you to share any remarks that you would like with the participants on the call. Dr. Wells, are you there?
Good evening to everyone. I want to thank East Greensboro Now and to all of the participants and to our moderator for enlightening us. I just have learned so much, and I think by the fact that these agencies and with collaboration and partnership with the city, we put all of our heads together, we can make it much better for our citizens. There are lots of resources, but the problem is that a lot of people don't know about the resources. So if we can spread the word, and I think those of you who are on the line tonight have learned just as I have, so that we can give some assistance and point someone in the right way. Thank you so much for having this forum tonight. I've really learned a lot. And I want you to know, if I can be any assistance to any of you, please contact me and I will do what I can.
Thank you so much, Dr. Wells. Appreciate you joining in with us this evening. And Ms. Hightower, Councilwoman Hightower.
Thank you, Ms. Sowell. Appreciate that. First, I do want to thank everyone for being on the call, for having this. A lot of information we took in, but important information as it relates to COVID. And so we need to be mindful. We do have the resources here in our community, in East Greensboro. And they need to be accessed. And yes, we do need to know where they are and what they do. And I know we have a resource guide, but I think we need to make sure that that's readily available to our community. And so I'd like also to ask, well, to Michelle, she listed a lot of testing sites that we need to publicize. And we need to, everybody's not online. So do we need to, how do we help get that word out to the community? Because testing was slow coming to East Greensboro. As a matter of fact, we were the last to be considered when it came to these testing sites. And they were started on the north side. And they finally got over here through much advocacy through some elected officials. And so we need to make sure that we are being tested, because we as African Americans are most disproportionately affected. So the site she listed, there's one July 2nd at Providence, one July 17th on Alliance Church Road. Also A&T on June 29th, 30th, and the 1st from 10 to 2 will be at Corbett Sports Center as well. So we've got to encourage our friends, residents, and all to get tested and to wear their masks, their face coverings, wash their hands, and social distance. Because until we do that, we're not going to get this to flatten the curve, in which we need to have done so we can go back to work on a full-time basis. So we are being able to provide for our families, work, and pay our bills. And so if we can all together make sure we get the word out. I think out of everything tonight, it's critically important that we pass this on. So thanks again to everybody who contributed. I want to thank the city staff. Chris and them have really done a phenomenal job. Kim, doing a great job. Jasmine, everyone. So we need to do this, however, on a more regular basis, so that we are spreading the word. So thanks again.
Great. Thank you so much, Ms. Hightower. Really appreciate you guys taking time out to be on with us tonight. And for those who are on the phone and could not enter anything into the chat, East Greensboro Now would like for you to provide your emails to them. They are going to be sending out links and information about all the resources that are available and follow-up information from this Zoom call. So if you could please call East Greensboro Now and leave your name and email with them so that they will be able to send you the information. The telephone number to call is 336-275-8255. 1101. Again, 336-275-1101. Please, please, please call and leave your information, because we've heard some really pertinent information tonight, and so we want to make sure that everybody has access to the information. So before we end, we're almost at our 8 o'clock hour, so I did want to provide space for Mac Sims to share any remarks that he may have. So Mac. Are you able to unmute, Mac? Okay.
Yes, I am. Can you hear me now?
Okay, there we go. Yes, sir.
Very good. I think Councilman Wells and Councilman Hightower said it exactly. And COVID-19 is impacting East Greensboro in many aspects. And what we need to do is make sure we get information out and get tested. And one of the things that we know that everyone's not on social media. So we will take the efforts to provide other information, other sources of information to the neighborhood so they can get that information. We'll provide through neighborhood association meetings and any other avenues to get that, because they do need the information. They do need to know where they're being tested, because we need to flatten the curve. And this is what we have to do. And we'll have many more of these events so that the community knows what is available to them. So again, thank you for all the participants. You've done great. Thank you so much. Good night.
Good night. Thank you, Mac. Thanks, everyone, for joining us. Please make sure that we're staying safe and we're observing the 3 W's. Have a great evening, everyone. Good night.